welcome back, everybody. My name is Dr. Khan Kao. Thank you for joining me on the channel. And today we welcome Dr. Karuna Dewan. Welcome.
Thank you so much, Dr. Cow. It's great to be here.
Yes, thank you. And she is an assistant professor at Stanford doing ENT. So she'll be discussing with us regarding ENT. So briefly, just tell us your path to ENT and the job description as well.
Sure. Like Dr. Cow said, I'm an academic laryngologist. I'm an ear, nose, and throat doctor or otolaryngologist, and I've done a 2-year fellowship in laryngology. So currently I'm only seeing throat patients who have difficulty with their airway, voice, or swallowing. And I've been in practice for about 4 years. Now, I am an academic otolaryngologist, which means I spend time caring for patients. That's the majority of my time, but I also spend time teaching medical students, residents, and fellows. And I also spend some significant time doing research. And research in the academic setting comes in many forms. I do specifically outcomes research. So seeing patients also enhances my research because my research is really about the patients that I see. So it all goes hand in hand.
Okay. Awesome. Thank you for that. And then what is the typical training path to become an ENT?
Otolaryngology residency is a surgical subspecialty. So it's 5 years. The first year is a combination of many things. There's 6 months of ENT in the first year, but the other 6 months are some other parts of the training, including ICU, ER, neurosurgery, plastic surgery. And those are areas in which we want you to meet the consulting subspecialties and understand how we all work together and how to take care of some sick patients.
Okay. All right. And then just thinking back through your medical school years, we all have tough time deciding which specialty. Can you just give us your thought process of why you chose ENT and other specialties that you were considering?
Yeah. So I was a neurobiology major. I did research in sleep, and the lab was run by a neurologist. And so I actually thought that I would be a neurosurgeon. I thought that I wanted to operate on parts of the brain. And during my neurosurgery rotation in medical school, was able to watch a deep brain stimulation surgery, which was absolutely captivating. We got to use the implant and see how the patient responded. And it was my neurosurgery preceptor who suggested that if I really liked that surgery, I should take a look at ENT because they do more things like that, whereas spine surgery is really like 70 to 80%, or neurosurgery is really 70 to 80% spine surgery. So at the advice of the neurosurgery preceptor, I looked into ENT, and it was fantastic. It was where I was meant to be. And I think a lot of this is figuring out what people and what group you fit in with and who you enjoy. And I have found ENTs in general to be very collegial and very welcoming and very friendly. The physician that I rotated with in medical school was pediatric ENT, and he and I are still friends. We still talk about interesting cases, and it's been a long time. So how I ended up doing what I'm doing now is I have a background also in broadcasting. I worked in radio in high school and in college, and have always been interested in the voice and why different voices sound different and why we like some voices better than others. And so that's sort of how I found laryngology. I thought I would be an otologist. I thought I would be an ear doctor, because that's sort of the transition from neurosurgery to ENT is through the ear. There's a close proximity there. And my first exposure to ENT research was pediatric otology research. But as I found laryngology, I think oftentimes when we pick a specialty or a subspecialty, there is a salient patient or a salient case or procedure. And for me, it was a patient who, she had a vocal cord paralysis. And so when she rolled into the operating room, she didn't have a voice. She had a very breathy voice. And her primary complaint, honestly, was that she couldn't order from a drive-through. She couldn't order food from a drive-through. And the surgery is done under MAC anesthesia. So the patient is awake. They don't feel anything or remember anything, but they can talk to us.
Mhm.
And so we make an implant and we put the implant in. And when she rolls out of the operating room, her voice is better. We can hear her voice. And it's that kind of thing that really resonated with me, that I thought I can really improve patients' lives. I can really have a positive impact on their quality of life through this particular subspecialty.
Okay, that's fantastic. Like you said, we all came into medicine wanting to help others, but
Yeah.
and also trying to find each of us trying to find what is our reward system that
Mhm.
continues to drive us to do what we do, so that way we're still passionate about our job and have a long-term work environment that's fulfilling. So thank you for that. And regarding the positive aspect of ENT, can you just discuss with us what you find is the most exciting
Yeah.
aspect?
So I love ENT and was drawn to it just because it's so wide and varied.
Hmm.
The ears, nose, and throat are very different organs, but they all interact with each other. Someone who has eustachian tube dysfunction will often have nasal symptoms, will sometimes have dysphagia. So everything is connected. And it's that interaction between these three, between kind of the whole system, the whole head and neck, that's very interesting to me.
Hmm.
There's also, you can make your practice, you can see the kind of patients you want to see, you can see the kind of problems you want to see, you can make your practice whatever you like. So you can have an all clinical practice and not really operate much, or you can operate a lot and you can do some big long surgeries. I've chosen laryngology because I like these patients. Quality of life for the patients is very important to me. And so I deal with people who have difficulty speaking and swallowing and breathing. And those are three things that are very central to life, to good quality of life. There's an old study that I often refer to where head and neck cancer patients were asked if they had to choose between talking and swallowing, which one would they choose? And a lot of them, the majority, chose swallowing. So they would rather have a prosthesis that helps them speak and be able to eat at the table with their family than be able to speak and have to use a tube for eating. So it's this kind of thing that motivates me. I focus specifically on dysphagia and helping people eat and enjoy food. And even if they're not eating whole meals, they can have a few bites that, satisfies your desire to smell something or eat something. So it's that kind of thing that has drawn me to ENT.
Very, very cool. And then on the other side of the spectrum, so that way students are aware if they do end up choosing ENT, is what are the frustrating aspects?
I think the same thing that is a blessing in ENT can also be sort of a difficult part, or the hurdle is that the ENT is so wide and varied. There's a lot of things to study,
Mm,
and sort of it's a lot of different things. That being said, there's a lot of similarities as well, and when it all kind of comes together, you can see how things are related, and so it's a great field. But like any field in medicine and any of the surgical subspecialties, there's just a lot to learn.
mhm, mhm. Thank you for that. And regarding medical students, are there any certain, or I guess I'll rephrase it. What are some of the characteristics that you think make for a successful ENT physician?
I think being detail oriented is will go a long way,
Hmm.
because there are just a lot of, in any of the surgical fields, but especially ENT, there is a lot of details to what we do. And I think more than anything, it's just really being interested, being dedicated. Um, ENT is seen by many people as sort of the gentleman's surgery, gentleman's surgeons, and that basically means we're kind, we're collegial, we work well with others, and there are a lot of stereotypes about surgeons, and ENT historically doesn't necessarily fit many of those stereotypes. There are lots of women in ENT. There are lots of minorities in ENT. It's sort of an all-encompassing, very welcoming field. So I think just being interested and having sort of a thirst for knowledge and a desire to learn more about the field is the best that you can do.
Hmm. And ENT, we all know it's very competitive to get in. And do you have any advice for students to just have increases their
If
chance of getting into ENT?
Right. If you think that you might be interested, get involved early.
Mhm.
So find the ENT department at your school and go meet some of the people. Meet them face to face, spend some time, ask if you can come to clinic, do some shadowing, and get involved in some research too. The earlier that you get involved, it's sort of, it's not just a one-sided process, it's a two-sided process. Like you have to decide if ENT is a good fit for you, but ENT also has to, and the department has to decide, if they feel like you'd be a good fit. So it goes both ways. So you're really looking for your new home, your new family, because you're going to spend more time with these kind of patients and with these people doing these things than you do with your family outside. So I think getting involved early, reading, looking on different websites, reading some of the journals, even if you don't understand everything you're reading, it's good to sort of get a taste, get a flavor. And then those people that you meet in your department, ask them questions, things like that.
Awesome. Thank you. And you kind of touch base about stereotypes that doesn't fit ENT. Could
Yeah.
you briefly tell us if there's any myths regarding ENT that you think it's unfair or untrue?
Yeah. I mean, I think we don't really fit the cookie cutter surgeon stereotype.
Hmm.
ENTs tend to be very nice and very understanding and very patient.
Hmm.
Not that, I'm not really super familiar with a lot of the surgeon stereotypes, but, I think and I'm obviously partial, but I find otolaryngologists to be very welcoming and
Hmm.
collegial. And I think it's a great field. When I was applying, the running joke was ENT stood for early nights in tennis. Um, you know, there may be some truth in all the stereotypes, right? I will tell you, after you finish training, and training is tough, residency is not easy, but after you finish residency, you can decide how, what your lifestyle is going to look like, and how much you want to work and where you want to work and when you want to work. Like you can decide all of those things. It often takes some time to figure those things out.
Mm.
But it's all very, very accessible.
Okay. And then thank you for that. And that was also one of my questions regarding work-life balance. And it seems like it's very flexible in how you want to detail. And if you want to touch base on, describe that further, or we can move on to the next question.
Absolutely. I think one of the nice things about ENT, and I had mentioned this a little earlier, is that you can have a clinic-based practice, or you can
Mhm.
have a practice where you operate a lot. I have one colleague who does ENT allergy and doesn't really do any surgery, but just treats a lot of patients with nasal symptoms and allergies and things like that. And those people are also very grateful, and that's a great patient population. So it just depends on what you're interested in and what you want your life to look like. And I think that's one of the great things about ENT is that you can really make it what you want.
Mm. As far as the specialty is concerned, what do you see? How do you see it changing in the future, 10 to 20 years down the road?
Yeah. So this is a really exciting time for ENT, and ENT has sort of been in this really exciting space for a little while because of all this new technology that has come about. So lasers, basically our ability to funnel a laser through a fiber and use that, the ability to harness light and use a camera, and endoscopes, the invention of endoscopes essentially, have really changed how we do things in ENT. And sort of the next forefront, or the next frontier, is robotics, and the use of robotics in surgery is that we're going to make the surgery, especially for things like I do, like laryngeal surgery or even otology, the ear surgery, is very, very small. So there's a degree of precision there that can be difficult for people, and is also very dependent upon the skill of the surgeon. And so the thought is that if we can make that robotic, there will be much more precision there so that you're controlling the robot at a distance rather than the human holding the instruments themselves. So I think that's sort of where the field is going at the moment. Yeah.
Okay, awesome. And then I know you work in the academic settings.
Mhm.
Do you work with NPs, PAs, and do they practice in private setting as well, if you're aware of that? And also on top of it, do you see their responsibilities changing over the years?
Yeah. So I think ENT is a great field for nurse practitioners and physician assistants. We work with them in the inpatient setting and the outpatient setting.
Mhm.
Um, in currently where I work, a lot of the nurse practitioners work very closely with the physicians. They see patients together, or they see return patients, they see chronic patients. Nurse practitioners that I work with, I see a lot of patients with chronic cough. So I'll start them on sort of a medication regimen, and then after a while, they'll transition to seeing the nurse practitioner for their return visits. So there are a lot of different ways to integrate the nurse practitioner into our practice. And that's true, I think, even more so than the academic setting. I think that's true in the private practice setting as well. And it's just a great, because there are so many procedures and so many things that we do in the clinic. It's a great opportunity for nurse practitioners to really do some hands-on work.
Okay, awesome. And then how do you see the job market for the current medical students or future medical
Yeah.
students in 5 to 10 years down the road for ENT?
I think the job market for ENT looks fantastic.
Mm.
I'm a little jealous. But it looks great for a number of reasons. Number one, our population is aging.
Mm.
So a lot of what we see in ENT are geriatric problems. So hearing loss, dysphagia. And so those are problems of the elderly. And as the elderly population increases in number, we will need more ENTs. The other component to that is also the impact of COVID. We're going to be seeing the impacts of COVID for a long, long time. And ENT encompasses the airway. And so we are just now starting to see people who have some airway issues or difficulties breathing after long COVID. One of the salient characteristics of COVID is that people lose their sense of taste and smell, and
Mm.
that's an ENT problem that's primarily dealt with by rhinology, or
Mm.
the people who do nose and sinus. So there are going to be a whole cohort of patients who have survived COVID who will need regular otolaryngology care.
Interesting. I actually had
Mhm.
never really thought about that. We see, I mean, we ask about the symptoms, and then I was like, oh,
Right.
you got COVID. And then me as a ER physician never really the 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 aspect of the
Mhm.
future about ENT, how it can be impactful for that. So thank you for that. And um, so, what are you're in academic? What are some other fellowships or opportunities that one could do with the ENT residency that you
Yeah.
know? Um,
So ENT or otolaryngology is almost like a subspecialty in itself.
mhm.
So you don't have to do a fellowship. I think about 50% of graduates currently are doing fellowships, and that's increased over the last few years. If you want to do a fellowship, there are a wide variety. There's pediatric ENT, there's head and neck cancer, there's the nose and sinus, which is called rhinology, or the ears, which is called otology. What I do is laryngology, so voice, airway, swallowing, so the throat part of ENT. There's also an ENT-based endocrine surgery, so they do thyroid and parathyroid surgery. There's sleep surgery, and then
Mm.
there's also plastics or reconstructive surgery. And these are all very different. They're different from each other, but even within each of these fellowships, there's a wide range. So for example, in the plastics and reconstructive surgery, there are some fellowships that are focused primarily on cosmetics. And then
Mm.
there are other fellowships that are focused primarily on reconstruction after people have had an injury or a cancer or something like that.
Mhm.
So there are many different ways and many different fellowships. And fellowship is a decision that you don't have to make for a very long time. Usually around fourth year of residency is when you start making fellowship decisions. So the nice thing about ENT is that you really don't have to do a fellowship. Comprehensive or general ENT is a great field. And I think it allows you to see and do a lot of different things.
Mm. Awesome. Thank you. And you kind of touched base about, you mean seeking out the department as your
Mhm.
as a great resource.
Yeah,
Can you tell us any additional resources that students can use to learn if ENT is a good
absolutely.
fit?
So there are a couple of really great websites. The American Academy of Otolaryngology, their website is entnet.org.
Mm,
There's a whole section on that website about becoming an ENT, like if kind of what steps you should take and the guidelines. There's the American College of Surgeons, also their website is facs.org, and they have a nice page also about ENT. What is it? And how to access that pathway. And then the last one is particularly interesting. I think it's called headmirror.com, and
mm,
it's run by the National Otolaryngology Interest Group. So it's run by med students and residents, really. And I think that's where the most sort of insider information is. Um, and on that website talks a lot about how to apply, what kinds of things residencies look for, and what to do after residency, what fellowships are available. That I find that website kind of the most helpful, the most sort of secret insider.
ah,
Yeah.
interesting. I'm
Mhm.
sure the students would appreciate that advice. I have one last question, and but before that, I just want to take this time to thank you for your time and advice to the students. I personally learned quite a bit, and I'm sure that the students most likely we get something out of this, and hopefully help them in the decision and if ENT is a good fit. So my last question is. Do you have any top advice for students who are interested in going into ENT? And then actually the second question is if you have anything else you would like to add that I missed.
Sure, sure. Well, ENT is a very, very welcoming, very open field. So the best advice I can give, a student who's interested in ENT is to get involved, find an ENT, and pick their brain. Ask them what their favorite parts about the specialty are, if they would do it again, what things they would change, things like that. So just get involved. And then, reading our journals, there's the American Academy of Otolaryngology has a journal. The
Mm,
Laryngoscope is our other big journal. Just read, kind of, the more you read about the specialty and the more you kind of pick it up and look at what the topics are, the better prepared you'll be.
awesome. Thank you for that. And that's all I have. I appreciate again of doing this for me and also the students. Thank you.
Thank you so much. It was a pleasure.
All right. Thanks.